Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello there, everybody. I am Dr. Mary Ann Pinkston, and this is The Better Life with Dr. Pinkston, and always bringing a mix of contemporary versus more natural, holistic medicine together. And a subject that we will go over today is no exception, and the eye. You know, I think that is an organ that we commonly disregard and leave out, and we don't realize how important it is to your vision and your health is there. It's the window of your soul. And today I have a very good friend of mine, Dr. Chip Wood from Wood's Vision Source in San Antonio, Texas. But don't mistake, Dr. Wood is all over the place doing a lot of speaking and spreading the good word. Dr. Wood, and I'll call you Chip because we are good friends. You call me Mary Ann, please.
Yes, we are.
We are. We have been together a long, long time. I think it started with our kids in band, and so gotten to have been able to get to know each other on a very personal level. But I will tell you, professionally, there is nobody that I respect more in eye health. Absolutely. You have brought a very, very alternative look, more in-depth look than most ophthalmologists that I send patients to. And then definitely we need ophthalmology. You always have the right people in mind and send us in the right places. But thank you for your service to the community and everything. And I'm so honored and glad that you are here today. Thank you for being on.
Well, thank you for having me.
Absolutely. So to jump right in, I know we're going to talk about a couple of really important subjects. And let's get it all in. We can. I know we can. So vision correction, some things I think people really, think they know a little bit about, but really don't. So let's jump in. First, tell us a little bit about you and kind of your history and training.
Well, thank you so much, my friend. I appreciate that. Yes, you know me as Chip. Professionally, Dr. Bobby Chip Wood Jr., and I'm the medical director for Wood Vision Source here in San Antonio. Like you, I do a lot of different things. I lecture nationally on lots of topics: dry eye, glaucoma, diabetic retinopathy, vision correction. Had the pleasure to be up with our good friends in Maine a few weeks ago, and just gorgeous country, and look forward to hitting South Carolina and many more places coming up. But my passion basically is to provide the highest level of vision correction and medical eye care to our patients. Yes. It started as a young boy. My grandmother was legally blind from macular degeneration. I never knew her having normal vision. It inspired me from a young age to basically follow that track. I've been blessed to practice at a very high level for 32 years now. For the last 15 years, I've been involved with Vision Source, which is the largest optometry community in the United States. We have high-level colleagues in all 50 states. We have 3,000 offices nationwide. We are the largest group in the country, larger than LensCrafters and Warby Parker and all the other groups out there. But the difference is we focus on medical eye care as well as vision correction. And then for the last 5 years, I've had the pleasure to be the consultant for Vision Source for equipment and contact lenses. It allows me to see a lot of new technologies that are coming out. And boy, we all hear about AI, artificial intelligence, and
right.
The next year there's going to be a major revolution throughout healthcare, but especially in eye care. So with that, thrilled to be an optometrist, thrilled to provide both medical and holistic eye care to my patients, as we've shared on many discussions together. And thank you for giving this platform to come and share some information with our friends here on the internet.
Absolutely, please. So let's go for it. I think you were interested. I know I've had a personal relationship with dry eye, and I want to spend some time on that. But to step back from that, just a little bit about vision correction. What's new and what is, you mentioned this is some great technology up and coming. So what's new in this world?
There's always great innovation out there. And just real quick, just Vision 101, there's 4 major focus issues out there. Myopia, which is nearsightedness, which means that you wear correction because your far vision's out of focus, and the correction of glasses or contacts or refractive surgery gets that far vision back in focus. It's caused by the eye growing too long. The length of the eye is too long. We have farsightedness, and that's where the eye is actually too short. And people who have hyperopia or farsightedness, they struggle with seeing up close. They see pretty well far away, but they often have eye strain and headaches and blurred vision with reading. And then the dreaded astigmatism. It's not astigmatism, it's astigmatism. And we don't have a cute word like nearsightedness for it, but your eye doctor may describe that as you have oval eyes or football-shaped eyes. And it means the surface of the eye, the cornea, is not perfectly spherical, it's oval. So with that, those can cause blurred vision far and near. And then unfortunately, even if you're born with perfect vision, in our 40s and 50s, we start to lose the ability to autofocus from far to near. And that's called presbyopia. And oftentimes people grab some cheaters at their favorite discount store, but eventually there might be the need for bifocals or progressive lenses or specialty contacts. So these are the four major focusing issues where vision correction is necessary. So, some of the new things out there that people should be aware of, in the same way we have high definition TVs and high definition tablets and cell phones, there are now high definition lenses for vision correction. And the benefit of these lenses is better vision and more comfortable vision. In our practice, we often recommend digital or high definition lenses to our young patients because number one, it gives them clearer, more comfortable vision. Number two, it reduces eye strain from tablet and computer use. It has built-in blue light blocking connection for all of those cell phone usage we're doing all the time. But most importantly, it can be customized so that we can help young people's eyes, which are changing so rapidly with growth, to change more slowly, to reduce that change over time. So there's a lens that we use in our practice called the Eisen lens, Eyezen. It's a customizable high-definition lens, and it gives better clarity, better night vision, less computer eye strain, and can be very successful for young children to slow down their rapid vision changes over time. Now, for those of us over 40, and you and I are a shade over that, I believe, unfortunately.
No, not me.
We have a little struggle with the close vision. So for patients who tried bifocals and traditional progressive lenses, they probably found that walking can be difficult, especially down steps and stairs. Peripheral vision can be blurry. Adaptation can be challenging as well. Well, I mentioned artificial intelligence earlier. It's here in eyeglasses. There are now progressive edition multifocal eyeglass lenses being designed using artificial intelligence computers. And the beauty of this is that it reduces the peripheral blur and distortion. It gives a larger reading zone, and it minimizes that off-balance feeling walking down steps and stairs. Traditionally, the older technology progressive lenses have a 1 in 10 not adapt rate or failure rate, but the new technology is about 1 in 100. In fact, the majority of our patients who choose this technology, when they pick up their new lenses, they go, wow, this is the best.
Wow.
Even my wife, who basically prefers her contact lenses, she finally got her a pair of these new AI technology lenses, says like, oh my gosh, you're correct. These are better. So fantastic. Nice. So that company is called Verilux. And so Verilux, they specialize in artificial intelligence lenses. And one of the lenses currently available through your insurances can be a lens called the Verilux XR. And so I highly recommend to patients who are struggling with progressive lenses or bifocals, speak to your eye doctor about Verilux XR lenses with AI technology. The mobility, it feels like you're 20 years old again wearing glasses. You don't have that funky feeling when you're walking and trying to read. It works pretty good. But it's not just vision correction. A lot of us struggle with other issues like light sensitivity, photosensitivity, chronic migraines that we've been seeing our PCPs, our neurologists. We're trying all these things. We can't find relief. Turns out over 50% of all migraine triggers are vision related. Sometimes it has to do with excessive near point work where our eyes are not lining up properly. And there's an eye condition called convergence insufficiency. And what that means is that when we look up close, the eyes have to turn in to focus on the target we're looking at. Sometimes the eyes don't turn in naturally enough. So we have to force them to turn in. Well, if those of us who are doing 4 to 8 hours a day on the computer, it's like your eyes are planking for that time period. It's a constant muscular stress.
Absolutely.
That can trigger the trigeminal nerve. As you know, as a medical doctor, the trigeminal nerve is the sensory nerve of the head area where we get our pain and things like that. It can cause an overstimulation. And unfortunately, that causes something called trigeminal oversensitization. That leads to dry eye symptoms, photophobia, migraines, vertigo in some patients. They discovered a lens technology called NeuroLens that can help to reduce this strain on the eyes.
Wow.
So the company NeuroLens developed a virtual reality headset test. It has an AI computer inside that goes through the test for the patient. It will test the far and near alignment. And if there's a significant misalignment, it will say, we found this misalignment today. Would you like to discuss treatment options with your doctor? And if so, we can have a discussion about NeuroLens eyeglass lenses. And what makes them special is something called contoured prisms. Now, prisms are found in glasses when you have an eye that's turned out or turned in or turned up. It helps with double vision and things like that for a lot of patients. Right. But we only can use one prism correction. And there's usually a different need for looking far ahead when the eyes are parallel versus looking close when the eyes turn in. So NeuroLens has the patented technology of contoured prisms to allow a different prism for looking straight ahead versus looking up close. And for many of our patients who struggle with migraines due to this thing called convergence insufficiency, it's a life changer. A lot of patients say, oh my gosh, now I can work all day long without the brain fog, the headaches, the migraines, the eye strain, the breaks. It's not for everybody because not everyone struggles with these things. But if you basically 4 to 8 hours a day on your cell phone, your tablet, computer, and you're having headaches and migraine that seem just really just unbearable, and you're finding that it's not treatable with traditional medical therapies and there's not a neurological answer, it could be a CI issue. So NeuroLens testing and NeuroLens classes can help with that. And the newest thing is called Avalux migraine lenses. And Avalux, these scientists did studies on patients who had light-triggered migraine. Patients barely go outside without sunglasses because they're so light sensitive. And what they found was that 3 colored wavelengths of light, the red light, the amber light, and the blue light, for some patients, they stimulate a chemical reaction in the retina that causes the severe light sensitivity, which can also trigger migraines. They found if they block out those wavelengths of light and try to primarily let in green light, relaxing light, it can immediately induce a dramatic reduction in the migraine, the eye strain, the light sensitivity, the discomfort. It's available as a non-prescription lens, as well as a prescription lens, as well as a clip-on option. So if someone says, you know what, I have this issue in this certain scenario, but not all the time, then if they're an eyeglass wearer, they could get their regular prescription for their regular needs. And they have a magnetic clip-on design that you just kind of put it right on your glasses in those highlight situations where you're uncomfortable, take them off when you don't need it. But it can be a full-time correction too. So, between the NeuroLens and the Avalux, about 50% of those patients who are not finding a medical neurological solution for their migraine, it's really making a difference for our patients. Here's the best thing though, Marianne. The companies have a 90-day patient satisfaction guarantee. So
90-day, nice.
If you say, oh, it's probably expensive and it's not going to work and I'm going to throw it in the drawer and I wasted that money, it's basically a medical correction for vision. And the companies say, you know what, we want to make sure it's the right technology for our patients who need this. So at Wood Vision Source, we have our patients who are candidates educated about it. For those who want to move forward with it, we help them with it. If within 90 days it doesn't work out, we just remake the glasses into their regular glasses prescription, and the company refunds the difference there. So some great technology and a no-risk trial period there as well.
Wow. Migraine, I'm so glad you touched on that because I see so many people. I'm a migrainer myself. I see so many people who, go through the motions of seeing me or their neurologist or whoever their primary care is, and, such few answers. I have found that both gritting your teeth, that and vision issues are linked, or a high amount of patients, not just a few, a high amount. I took that test that you offered there at the office and found that there was a minor problem there, but it was there, and very easy test to do. No pain involved, nothing, just very little time.
Like a video game, right?
Like a video game, very easy. And I think patients need, if you have a long history of migraines, you need to have that checked. Absolutely.
Sure.
Absolutely.
Yeah.
Wonderful.
Great test in there. Perfect. So and then it's not just glasses that have new corrects. Right. A lot of patients wear contact lenses. We find that as we get to be 40 and beyond, more than half of the population who wore contacts in their pre-40 years tend to drop out because of trouble with dryness of the eyes, with blurry vision, vision correction issues, things like that. So the first thing I want to talk about in the contact lens section is high definition contact lenses. Believe it or not, we now have HD lenses in both a soft lens design, a hybrid design, part soft, part hard, and also the hard lenses too. So we now have daily disposable and monthly disposable soft lenses that can correct nearsightedness, farsightedness, astigmatism, and the dreaded presbyopia reading issue in both a monthly and daily disposable option. So what's great about this lens technology, besides better vision driving at night, less starbursts and halos from car headlights, crisper, sharper vision, is that they also frequently include UV blocking technology from the harmful UV rays from the sun, which with our eyes over a lifetime can cause cataracts and macular degeneration. It also can have blue light blocking to reduce the stress from cell phones and computers and things like that. They also have more oxygen, more moisture. And one of the newest technology actually fights contact lens dryness by pre-injecting moisturizers, electrolytes, and osmoprotectants in the lens. So while you're wearing the lens, it actually leaks into your eye to support comfort. Because most of us, when we look at a computer screen like we're doing right now, we're staring. We're not blinking enough. Our blink rates slow down, and that induces more evaporation of our tears, and that causes the blur, the discomfort, the dryness, things like that. So, some of the new soft lens technologies, high oxygen, high moisture, blue blocking technology, UV technology, and HD clarity. So at Wood Vision stores, the majority of our patients now wear these types of lenses. And when they've worn an older technology and we say, let's try this and see what happens, they're usually like, wow, these feel a whole lot better. And wow, the screen's a whole lot more clear. So they've been very successful. But not to leave out us 40-plus-year-old patients, when we get to the point where we have to grab those cheaters and reading glasses and all that, we now have multifocal soft contact lenses. And these are lenses that provide far vision and close vision. And one of the newest lenses has all the tech I just mentioned, high oxygen, blue blocking, water, all that kind of stuff. But it also has zones of correction for driving, for the computer, and for reading. So it gives you dynamic focus and all, kind of a very natural visual experience wearing the contact lenses. So for those who don't want to wear glasses, they don't want to wear cheaters, so not ready for a surgical correction, this has been a wonderful therapy. But here's the thing, it doesn't have to be your everyday correction. If you're satisfied wearing glasses for most of your day, but you have a wedding or a social event or a quinceañera, or maybe when you work out or play pickleball or golf, you prefer to wear regular sunglasses and not have to wear corrective lenses, these can be part-time use lenses as well. So they're available as a daily replacement option or a monthly replacement option that you clean each night and reuse. So lots of options to help people to see their best with great comfort and vision. So if you say, I tried contacts basically even 2 years ago, this is in the last year. This is new technology. So be sure and either come see us at Wood Vision Source or ask your eye care provider about this technology.
Absolutely.
But you know what? Sometimes it's not just the four myopia, astigmatism, hyperopia, presbyopia issues. Sometimes there's other problems such as eye conditions like keratoconus, which is a bulging of the surface of the eye that can cause severe distortion that even glasses and soft lenses can't correct, or severe dry eye like Sjogren's syndrome patients who have severe dry eye, dry skin, dry mouth. Their eyes get so dry, the surface is so irritated, they just can't get comfortable with medications and things. So we now have a special high definition lens called a scleral contact lens. Now, the scleral lens was initially introduced about 10 years ago at some of the higher end medical clinics, like at Harvard and things like that, Bascom Palmer in Florida. And they were using it as a subspecialty for helping with severe dry eye. And the way this lens works is that it has prescription. It's very large, about 16.5 millimeters. The lens rests on the white part of the eye called the sclera. There's no nerve endings there, so there's no discomfort. It's very comfortable to wear. The lens, you fill it up with a preservative-free buffered saline before you put it on the eye. So when you put it on the eye, it now keeps the surface completely covered throughout your day with moisture. So in addition to bathing the eye to keep it comfortable and clear and healthy and all that, it also protects the eye from evaporation from staring at the computer, ceiling fans, the wind outdoors, things like that. Now, this lens used to be a very subspecialty lens, but now it's become more mainstream. And so we have many, many patients in our clinic who are just unable to see clearly due to things like severe dry eye, keratoconus, corneal scars, things like that, bacterigiums, which are growths on the eye. So we're able to fit them into these lenses, and it gives them clear, crisp, comfortable vision. And when they have a painful dry eye issue, it often helps to relieve that pain to make the eye healthier as well. So this is something that can be a wonderful improvement for those that have not just visual needs, like super high astigmatism, but also it can be used for medical eye conditions, again, like severe dry eye, Sjogren's syndrome, keratoconus, corneal scars, things like that. A lot of the patients also who've had corneal transplants because of eye health diseases like Fuchs dystrophy and things like that, it is the lens of choice to get optimal vision correction after that as well. And then the coolest thing, which I really like to share with our parents, is that, they always come and say, you know what, doctor, my child is wearing full-time contact lenses, full-time glasses. When can they have LASIK? Well, before we get into all that, children can't have LASIK. And there's two reasons why. Number one, their eyes are not done growing. And because the eyes are growing, the prescription will keep changing. So you don't want to have LASIK until you have stability. Okay? But two, we just don't like doing surgeries unnecessarily on children no role either. So with that, parents say, well, is there anything we can do? We'll say, well, we do have what's called orthokeratology. And orthokeratology is a temporary, safe, gentle molding of the surface of the eye, similar to what LASIK does. So when we do LASIK, the surgeons are using a laser to flatten the surface of the eye to reduce the nearsightedness prescription of the eye. So with orthokeratology, we use a special contact lens. The child puts it in their eyes right before bedtime, like retainers for their teeth the orthodontist gives them. When they wear this retainer contact lens overnight, it molds the eye to reduce the curvature to take away the blur. In the morning when the child wakes up, they remove the contact lens and they can see 20/20 without having to wear glasses and contact lenses. This is an immediate and temporary treatment, which means each night they have to put it back in the hold. In the same way, after you have the braces come off, if the child doesn't wear the retainers, the teeth might start shifting. Same with the eye. Now, we have lots of children as young as age 8 who are doing this. Some of them struggle a little bit with the in and the out, and the highly motivated parents are great in the early days of kind of helping them with that. And then as they get more comfortable, they do it themselves. But in addition to giving daytime clarity without the need for daytime contacts and glasses, it also slows down the growth and the worsening of vision to the eyes on an annual basis. So it slows down progressive blur, but it also gives daytime clarity. So a lot of kids who are into dance, water polo, swimming, diving, volleyball sports, this is a great solution for them so they can do those highly active and kind of challenging environmental sports without having the struggles of glasses getting sweaty or glasses falling off or contacts in the pool getting chemicals irritating the eyes.
Or losing them or losing them constantly.
So orthokeratology has been a wonderful kind of pre-LASIK treatment for children to both keep them from having a high prescription as adults, but to also give them excellent daytime clarity. And one of my most moving favorite stories that I had a physician's wife come, and she has a family of 4 children, and she was a highly nearsighted patient who had LASIK successfully. And she was just hoping that her oldest daughter was the first one to start going through this change, would not be like her. And her daughter was relegated to full-time glasses because of her myopic vision problems. So we talked about orthokeratology, and like a good, diligent parent, she researched it online, and we gave her information about it. She talked to some parents who'd had their children do it successfully, and she said, I think we're ready for this. And so they came in for their initial dispense. We placed the lenses on the child's eye the night before. She was a trooper, no problem, got them in. Came in the next morning. We removed the contact lenses, and that sweet little darling read 20/20 on the bottom. Mom was in the corner, just tears coming down her face. She goes, oh my goodness, my child can see 20/20 without glasses now. And it was such a moving moment. And so to see just that mother and child interaction. And that young lady is now, she's 3 years into orthokeratology, and she comes in for her 6-month checkup, just smiling and happy as can be. Nice. And the great news is she's really had no significant change in her vision correction in 3 years.
Nice.
For that, it was changing every 6 months. And so
nice.
We have lots of wonderful success stories like
yes, you do. Absolutely.
Yeah. And then, but a lot of people say, you know what, Doc, I don't want to wear contacts. I don't want to wear glasses. What else can I do? And I think we both know a lot about refractive surgery because it can be a permanent way to correct your vision. So first of all, to even be considered for refractive surgery, we want to have a stable visual correction. And we know that for young people, their eyes can grow and change up to age 25. Okay. So somewhere in the early to mid 20s is when kind of the time to really think about this is. Now, from the 20s to the 40s, LASIK is a great solution. And LASIK had a lot of adjustments over the years. Back when I had LASIK in the 1990s, in the early days, I was like, why did I do this? Because we were using like jelly slicers to cut the eye to make the flaps, and all that seem archaic right now. But they were successful, but they had some complications. But now it's modern LASIK is completely all laser. In fact, it's high definition lasers. The new technology has really remedied most of the early issues we had with nighttime glare and halos around light that were debilitating. We can do higher prescriptions with better success. We have better pre-screening equipment for doing diagnostic evaluation. So modern LASIK is now very successful for both farsighted, astigmatism, and nearsighted patients. And so with that, it's been wonderful. Between age 20 and 40, that's the right time for that. And the reason we say 20 to 40 is that after 40, that thing called presbyopia happens and we start to lose vision. So when I had my LASIK, I was 28. I could see great far and near, but now I'm not 28 and I have trouble up close. So I wear AI Verilux progressive lenses to have my best far and near vision. But if today I were going to have it for the first time, I'd probably choose a different procedure that could give me far and near correction. So with that, we have something called refractive lens exchange. And so it's actually the same procedure as cataract surgery.
Yes. My husband do this and he loves it. He loves it. So this is the first I'd heard of it.
I'm glad I'm not going to talk about my patients on this podcast, but I'm glad you brought it up there. And definitely, people who've had this are like, wow, I had no idea it was available. And wow, I feel like I'm 20 again. I can see far, I can see near.
Yes.
So I'm glad he's had wonderful success with his experience there. And basically the natural lens of the eye, which gets cloudy as we age due to aging, genetics, sun exposure, UV damage, things like that. Once it gets excessively cloudy, it's removed and an implant lens with a prescription replaces it. Well, that surgery is so predictable and safe and so easy to do for most good surgeons. They're now doing it for non-cataract reasons, for those that have prescriptions or they're trying to reduce the need for vision correction. So refractive lens exchange, the surgeon can remove the natural lens of the eye. They can replace it with a lens implant that has a prescription that can focus, again, myopia, nearsightedness, farsightedness, hyperopia, astigmatism, and the dreaded presbyopia, the reading, and it gives excellent vision far, near, and close. So we tend to recommend that for our 45 and older patients because we know that as they continue to mature in age, they're going to have more and more difficulty with their close vision. Also, once you've done it, you're done. Because what causes most vision changes past age 40 is that lens in our eye aging, getting cloudy, changing focus, changing prescription. Once we have that synthetic lens inside of our eye that doesn't grow or change anymore, it's pretty much done. Right. And so if you're 45 or 50 and you've been wearing glasses and contacts and you think, you know what, I'm looking for a surgical correction to give me great far vision, great near vision, and I want it to be a lifetime correction. Nothing's guaranteed, but this is the closest we have right now, and I highly recommend that to have that done. And then there's that sort of group there that has high astigmatism or high prescriptions, or like a -10, -11 prescription, and maybe they're not the right candidate for LASIK. Well, there's a new technology. It's been out about 5 or 10 years now called the EVO ICL, and this is the implant that can be put into the eye but without removing your natural lens. And it's an excellent technology for those that have big prescriptions. They're not the best candidate for having LASIK. They're not ready for the refractive lens exchange, but they want to have great vision without having to wear thick glasses or super high contact lenses. So you may have heard of one of the Jonas brothers, Joe Jonas. He's been a popular celebrity out there in the news. And so anyways, he's their celebrity spokesperson. He was someone that had plenty of income to afford LASIK, but wasn't the best candidate. He had the EVO ICL technology for high astigmatism. He's done great. And our patients who've gone this direction have been very, very pleased as well. So for those who are looking for surgical correction, LASIK or modern LASIK with HD correction is an excellent choice. EVO ICL, if you're not the best candidate for LASIK, but not ready for the reading correction. And then for those over 40, refractive lens exchange is an outstanding option. Absolutely beautiful. And I'm so glad you bring all that up, because I was kind of in between all this great technology and did the LASIK where, now I have the one eye that sees far and the one eye that sees close. And it drives me crazy. It drives me crazy. We call that monovision. And for some people, it works great. About 75% of the population, whether it's through contact lenses or through LASIK, and sometimes even with cataract surgery, we can do one eye far, one eye near. The challenges are, if you have LASIK monovision, the lens in the eye continues to mature, it continues to change. So frequently it starts to drift over time, and then you kind of have both eyes a little bit off as you move forward. And then in the day and age of computers, we have far vision, mid-range vision, close vision, but only two eyes. So you got to kind of pick which one you want, right? So going to a more natural multifocal binocular correction, which is the more new technology, that keeps you like you were supposed to be, using both eyes together. But we still, for those who are successful wearing monovision contact lenses or successful with monovision LASIK, if they're going to have cataract surgery, we'll often keep them in that if they're happy with it. But the trend tends to be to try and keep the eyes working together for better depth perception, better visual clarity. Thank you. But you're right. Back in the early days, a lot of monovision LASIK was done. And not knocking it. It was what we had, right? And it's been fine. I just know that there's so many better things now, and you've just explained all of that. So exactly. We've done very well. We have, I'm going to take a short break, Chip, for just a minute and kind of bring in Magna Pharmaceuticals and let people know a little bit about the methylated B12 that I promote. Tell us, though, first, where can people find you and more information about you and all these procedures? Fantastic. So I'm the medical director for Wood Vision Source in San Antonio, Texas. Our address is 8910 Bandera Road in San Antonio, Texas. Our website is www.woodvisionsource.com. And check us out on Instagram at wood_VS. Lovely. And that will all be on my website as well, drpbetterlife.com, as well as all my previous shows and whatnot. We are going to come back and talk a little bit more. I've got a great question for you. So everybody hang on just a second. We'll be right back.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Awesome. Thank you, Magna. I appreciate that. And thank you, Dr. Wood, for being on and talking about all this great information. I know you had a lot to give in the vision correction, area. And I don't know if you have more to go there. That's fine. But I also wanted to talk a little bit about dry eye. And we probably need an entire 5 shows for that. That's one of my favorite topics, and you know why. But yeah, I don't know if that was a good time to kind of cross over.
Perfect time. Yeah, I think we wrapped it up really nice in a bow. And let's move on to talk about dry eye. Yeah.
Oh, please. Absolutely. Dry eye is so common, and people really don't I think they really don't understand it and handle it well, but know how a lot of times you can live feeling very miserable with it and not know there are things that you can do and need to do. Absolutely. So
I think that, part of it is understanding that we've kind of reduced the importance and severity of addressing dry eye. I got dry eye. Oh, I got allergies, that kind of thing. And what people don't realize that it is an eye disease. It is a debilitating condition for 83 million Americans every year. It can lead to blindness. It can lead to missing of work and reducing your ability to enjoy your life and be with friends and things like that, doing fun things. So it's different levels. And some of the things that are happening are self-induced. And we can do some things simply without medications, without prescriptions, without procedures, just some minor modifications to really make a big difference. But then for those who have more serious issues, more we can do. So, one thing it's great timing with this conversation, because there's a group of brilliant scientists and eye doctors and dry eye specialists who are an international group of just brilliance. And they're called the Tear Film Ocular Surface Society. Okay. And approximately every 10 years, they get together and they look at all the modern research connected to dry eye. And they come together and say, this is what all the eye doctors need to know about dry eye, diagnosis, management, treatment, and things like that. Well, in 2007, they had their first meeting, and they called it the Dry Eye Workshop, and they call it DEWS for short, Dry Eye Workshop. And so the DEWS 1 report kind of was the first one to start saying, dry eyes is not just not making tears. There's more to it than that. There's issues with the glands not functioning. There's systemic conditions associated with it. There's environmental associated with it. And they had a guideline of what to do. Well, 10 years later, in 2017, they had the DEWS 2 report. More information, more diagnosis, more separation of the different multifactors that can lead to dry eye syndromes, mild, moderate, severe, and guidelines on how to manage it. Well, 2 weeks ago, they just released DEWS 3. Nice. And you'll never believe this, but guess what one of the biggest modifiable things we can do to help with dry eye symptoms is?
Probably diet.
Well, that plus put the cell phone down. Okay.
Oh, yeah.
Because absolutely there are some things that contribute to our eyes getting more dry. Yeah. But we know that about 84% of all dry eye conditions, from the most mild to most severe, are caused by tear evaporation. So real quick, basically, high-look dry eye 101. The eyes make 3 things that create our tear recipe. We have water, we have oil, we have mucus. And like with any recipe, if it's out of balance, it's not going to function properly. So the smaller minority group is going to have lack of water production. And that can be caused by systemic health conditions like arthritis, lupus, Sjogren's syndrome, thyroid disease. Sometimes hormone estrogen replacement therapy can do it as well. Now, it can also be a side effect of medications, because oral antihistamines, blood pressure medications, antidepressant medications, a lot of these have a known side effect of also causing reduced tear production, meaning reduced water production. Now, when our eyes make plenty of water, sometimes the issue is evaporation. Sometimes that happens because we're staring at our cell phones and computers all day long. When we stare, we blink less often, and that causes more rapid evaporation. That's a modifiable problem. Sometimes we're sitting under a ceiling fan. Sometimes we're outdoors in the wind. Sometimes the carbon is blowing in our face. Those are modifiable environmental conditions. Sometimes, though, it's caused by the oil glands of the eyelids, which are called the meibomian glands. They're not functioning properly. So we call that meibomian gland dysfunction, or MGD. MGD can be caused by lots of things. Sometimes it's a skin condition. So patients who struggle with acne and rosacea, you can have ocular rosacea. And that condition causes the oil glands to become inflamed. You get pimples and get pus and all that. Well, the lids can have the same thing. So styes can be a result. Sometimes the oil that comes out, instead of being pure like olive oil, it comes out like melted butter. It's full of inflammatory factors that can attack the eye. So it's kind of like getting chemicals in your eye. So that can cause that red, burning, itching, watery eye. Sometimes it's the things we put on our skin. So a lot of patients will use retinol or moisturizers around the eyes. Great to help with puffy eyes, dark circles, wrinkles, crow's feet. The challenge is that over time, the retinol can clog up the oil glands, and that causes a form of meibomian gland dysfunction. Very, very well known, and a lot of patients struggle with that.
Accutane too? Does Accutane do that too?
So Accutane is kind of different. Accutane, it actually kind of destroys the glands, which is actually more difficult. So patients that struggle with acne, the problem is that it kind of shrinks the gland to minimize the clogging. So a lot of patients, not all, but a lot of patients who had Accutane treatment, when we study the glands of the lids, we can physically see loss of a lot of those glands.
Oh, my goodness.
Reckon if you have less glands in your eyelid, you're going to make less oil, which means you have more evaporation. Now, there are some treatments we'll talk on a little bit later that can help to restore, rebuild those glands anecdotally. But yes, Accutane can be a struggle, not because it clogs the gland, but it can injure and damage the gland. So in the same way you might see an adult that has little pock marks in their face from they had bad acne as a child. Well, the pocks are where those glands were damaged and they kind of shrunk and shriveled. They scarred down and they're pulling in, causing those dimples. The same thing can happen on the lids. Yeah. So, and then, but other things like whitening creams and those things, makeup. There's something called makeup migration. And so a lot of patients, men and women both who wear eye makeup and things like that, they'll apply it all the way to the top of the lid, not realizing that it migrates and it will go into the eye. And we frequently see patients who look gorgeous with their lash extensions and their mascara and their shadow, and they look beautiful. But I see all these chemicals floating on their eyes, and they go, my eyes are always red. They're always burning. I'm having trouble. Makeup migration. So important to kind of keep the makeup under the lash on the bottom lid, over the lash on the upper lid, so there's less chance of it getting in there. When applying moisturizers and creams, we recommend that where the bone is here, the orbital bone, stop at that bone with your sunscreen and your wrinkle creams, because it will move where you want it to. If you do that or you do that, it's going to get in the eye. And that one little tip helps a lot of people out there. So be careful with that. Yeah. So those kind of things. And then of course, if you're outdoors, consider wrap style eyewear, wrap style sunglasses or safety glasses to keep the wind from blowing in your eyes. If you're in a home with a ceiling fan, consider having the fans go in a direction so it pulls the air up versus blowing down on you, because these are environmental things that can help to make your eyes less irritated. Again, reduce your screen time and just blink more. But having said all that, sometimes we still have the issues, right? So for those that say, you know what, doc, I need to use my lash growth serum, but it makes my eyes red. I need my eye brightening cream because of the puffiness and but my eyes are irritated.
Not giving it up.
My makeup, and I got to get it off with an oil-based cleanser to get it off. Or I have red eyes every day and I'm using Visine or something like that to get the red eyes. And I know I shouldn't, because they actually constrict the arteries, which reduces oxygen flow and causes rebound problems.
Correct.
So with all that, pro tip here, Bausch & Lomb has come out with dermatology and ophthalmological approved treatments for around the eyes that will help to minimize those issues. So they have a lash growth serum that does not have the chemical irritants that cause the eyes to get irritated. The primary ingredients are biotin, which is great for hair growth, as well as micellar water and hyaluronic acid. It's called Illuminations Lash and Brow Serum. My wife says it's the best one she's ever used. It's about $30 at your local store. They sell it online. Don't need a prescription. Highly recommend that one. They have an eyelid brightening cream. It basically does not have chemical irritants or retinol. Excellent for tightening the lower lids, reducing the dark circles. It helps to add moisture to basically to plump up the skin when you have a sagging skin. It's Illuminations Eyelid Brightening Cream. I recommend that for those who are struggling with challenges with the other moisturizers and the retinol-based creams.
Got it.
For removing makeup, if you remove your eye makeup with an oil-based product, that oil basically clogs up your glands and often gets in the eyes, causes irritation. So micellar water eye makeup remover is readily available by many, many manufacturers, including Bausch & Lomb. It has hyaluronic solution in there for doing that. I highly recommend using micellar water for non-soluble makeup removal versus an oil-based product. And then if you still have a little bit of redness in the morning with those beautiful white eyes when you're doing your podcast or you're going to work or what have you, then Lumify eye whitening drops is a safe alternative to other red eye drops. It shrinks the veins instead of shrinking the arteries, so it doesn't reduce basically blood flow. So, and it doesn't have a rebound effect like the other ones do as well. So if you need to use eye products basically, and you're having some side effects to them, those would be very safe, over-the-counter, non-prescription, inexpensive drops to use. And again, they're both dermatology and ophthalmologically approved for great work. But, sometimes you got to take it up a notch. You got to do more than just avoid things. And so there's something called heat, clean, and rinse. And so we know if we heat the eyelids, that's going to help to stimulate the glands to make better tears and get rid of the clogs. If we clean the eyelids, it's going to get away the makeup, the moisturizers, the bacteria, the things in the lids that kind of complicate the dry eye syndrome. And then if we basically lubricate, that's going to moisturize as well. So 3 simple at-home things you can do that I highly recommend to my patients. There's a product called a Renpho Home Mask, Renpho. You can purchase it on any of your favorite online stores, Amazon.com, things like that. It looks like a virtual reality mask, but it's an electronic heater with massage. And you can put it on your eyes and have your spa moment at home. Run it for 15 minutes, and it is an outstanding therapy for heating those lids and clearing the glands and massaging. And that makes a big, big difference for a lot of our patients who are struggling with evaporative dry eye. You can see significant improvements in just a couple of days of doing it. From a teardrop standpoint, we call it the wall of confusion. You walk into your pharmacy and you see 1,000 different eye drops, and some of them are from the 1970s, and which one's the one I should use? And so generally, preservative-free drops are the way to go. And your doctor can basically evaluate which type of dry eye you have, evaporative versus aqueous insufficiency, lack of water versus both, and recommend different types of lubrication for what you need. Do you need more water? Do you need more oil? What do you need? Well, if you're not quite sure, a company called Alcon, they just came out with a new teardrop called Cystane Pro PF. The PF stands for preservative-free, and it's the first triple-action teardrop on the market. It's preservative-free, and it has everything you need for aqueous insufficiency as well as evaporative dry eye. So if you're looking for something over-the-counter that's going to be preservative-free and safe, it can kind of hit everything if your type of dry eye has not been diagnosed yet. That's a great way to start. And we talk about holistic, you and I, when we first talked many years ago about how do we manage dry eye these days, we talked about holistic ways of doing things. So we know that omega-3s are fantastic for basically anti-inflammation benefits for the body. It's been shown to reduce cholesterol, helps with brain function, helps to reduce leaking from diabetic issues. But for the eyes, it can help to stimulate tear production and reduce inflammation. So specifically, you want to have what's called triglyceride-based reesterified omega-3s. What does that mean, right? So when they make omega-3s, they basically take the fish and they stamp them up, and they use alcohol to extract the omega-3s from the fish. Now, inexpensively, they then just take that, put it in a capsule, and sell it to you by the bucket at your favorite store. Well, that alcohol is disruptive to the lining of the stomach. And that's why a lot of people who take inexpensive fish oil have the stress with their GI system. They have reflux. They get the burps, things like that.
That's right.
A medical grade, but not prescription, just medical grade type, it's called a triglyceride-based or TG Reesterified. And what this is, they do the first process with the alcohol, but then they use reesterification to remove the alcohol to get the omega-3 back in the triglyceride state, which is what the fish was in the ocean in the first place.
Right.
So this is more easily digestible. It has much, much less effect on the GI distress and the reflux. So with that, if you want to get about 2,200 milligrams per day of EHA, DHA with omega-3s, I take them myself. The brand I prefer to use is called MacuHealth TG Omega-3, but there's also Nordic Naturals TG Omega-3, and there's also one called PRN D3, and these are all readily available over the counter, excellent type omegas, and I'm sure that there's other ones out there that are very good as well, but these are ones that we found that do have a high quality benefit for treating dry eye. So keep those lids, and you can use a washcloth, but it doesn't stay hot very long. You can use a mask in the microwave, but it cools down too quick.
Right.
Modern technologies have Renfo mask, Cystine Pro, great teardrop, and the omegas as well.
Beautiful information. Thank you. And that MacuHealth, you have that at your practice. You had me.
Yeah, I find that to be the most cost effective and most easy on the stomach one to use. Yeah. So I use that as well. Right. Yeah. It's 4 capsules a day, but they're tiny capsules. They're easy to swallow. And so, and again, in addition to the dry eye benefit, you get the benefits of vascular health and lower cholesterol, reduce arthritis pain, things like that.
Yes, absolutely. Yeah. Love it. So good. Thank you for that. And then, and so in the step up, what if you're failing there and you gotta,
sometimes you gotta write a prescription sometimes, or do a procedure. So traditionally we've had some great medications, for the last 20, 30 years. Restasis, Xiidra, Cequa, generic cyclosporin. These have been eye drops that have been prescription for many, many years. They all sting a little bit when they go in. Sometimes they taste a little bit funky, and they work most of the time. The biggest challenge has been going to get insurance approval to get them sometimes, so some insurance won't cover them. But they can be helpful, but they've not always been as well or as effective as they should. So some of the new prescription technology, a new medication called VEVI came out earlier this year, and the VEVI is a cyclosporin-based medication, double the concentration of Restasis, double the concentration of Cequa, but it also has a new liquid carrier. And so instead of being a water-based carrier that has a pH that stings when it goes in the eye, the VEVI has a new molecule that's non-water-based, and most patients can't even feel it when it goes in. It feels like velvet when it goes in, right?
You described that well, yes.
You're nodding your head there.
Yes.
Very comfortable, very soothing, very effective. Most patients will get benefits within 30 days, whereas the other ones take about 60 to 90. So with that one, they've been prescribing a lot of that, and some great feedback on that.
Yes.
Another one, and that was more for the aqueous insufficiency, patients that have dry eye associated with RA and lupus and Sjogren's and things like that. For the evaporative dry eye, you may, if you watch TV, you've probably seen the commercial for Mibo, and they use that Ferris Bueller song to kind of hype it up. But Mibo is a 4 times a day drop that has synthetic lipid, and it helps to create a new oil layer or lipid layer to lock in the moisture to slow down evaporation. This is a great drop for patients who are struggling with evaporative dry eye from long periods on the computer, on their cell phones, sitting in the ceiling fans, being outdoors in the wind, things like that. We've had great patient feedback from this one. The FDA studies were for 4 times a day. For some patients, twice a day seems to be adequate, but 2 to 4 times, and it works very, very well. Neither of these drops should be used while wearing contact lenses, but they can be used before and after, things like that.
Nice.
Coming soon, a new medication was just approved by the FDA called Tryptyr, Tryptyr. It's supposed to be available Q3, so sometime next month, actually. This might be the game changer. This one works by stimulating the corneal nerves. It's a neurostimulator, and that's going to then stimulate the trigeminal nerve to then kick on the gland that makes the water in the eye. So the results showed that patients who used this drop had a 4 times increase in tear production on day 1. So we're thinking that this might be the game changer for those who really struggle. So,
exactly.
I'll put your hand up. So as soon as I get a sample, I'll give you a holler. Okay.
Thank you.
We'll let you give us some feedback on our next podcast together.
Thank you.
So,
you got it.
I'm looking forward to that one. And so that should be coming out pretty soon. And it'll be a twice-a-day medication, perfect for those who wear contacts before and after, or those who don't as well. But Triptyr from Alcon, and it should be coming out Q3.
Fantastic.
But there's also some procedures we can do. There's 38 million individuals who are really, really needing a higher level of treatment. And a lot of them are senior adults. A lot of them have arthritis. A lot of them can't squeeze the bottles to get the drops in, or they're a really bad drop tagger. So we can do things to help our patients. And so something we've discussed in the past is something called collagen plugs or punctal plugs. And so the puncta is the drain of the eyelids where the tears drain. You have one in the lower lid, one in the upper lid in the corner. You blink, the tears go to the corner down the drain. That's why you put drops in some that you'll taste in the back of your throat. So we can add more tears. That's what lubricants are. We can make more tears with medications and omega-3 capsules, or we can keep the tears on our eyes on the eye longer by putting a plug in the drain. So like putting a plug in your sink or your tub to fill it up with water. So there's 3 traditional ways of doing that. We had silicone plugs that could be put in, and they were basically semi-permanent. They didn't dissolve, but sometimes they would cause granulomatous growths in the tubes. They would go inside and cause infection. They would rub the eye and be uncomfortable. I kind of stopped using those about 6 years ago due to complications like that. There's surgery. You can have a surgeon close them up with cautery. Very effective, but basically it's kind of uncomfortable to do. What we tend to do most in our clinic before this new invention that came out recently is collagen plugs. And so collagen, we have these little plugs, they're dissolvable. They can have a life of 5 days, 3 months, or 6 months. We painlessly place them inside the drain. You won't see them. You won't feel them. They basically last for a certain duration. For those who are like, I don't know, it kind of worries me. We'll do a 5-day test, see how it goes. So far, knock on wood, we have 100% of patients who are like, oh my goodness.
You will be glad you did. Thank you. Yes. Right.
Yeah. Please, right?
Oh, yeah.
So most of them, we do a 6-month disposable plug, and then every 6 months they come in, we'll reevaluate. The plug is usually dissolved by then. They'll replace it painlessly, and it's covered by health insurance in most cases and very affordable. And it's a passive way of treating dry eye because we're keeping more tears on the eye. You don't have to use drops as much, and patients find it simpler to improve their vision for reading and for being outdoors, enjoying sports and things like that. But what's new is that for anyone who's done aesthetics, about filler, and filler's been used by dermatology for years for, plumping up the skin and getting rid of wrinkles. So now we have hyaluronic acid filler for punctal occlusion. So the company called Lacrofill, and they now have Lacrofill gel, and we use a small cannula. It's like a needle, but it's not. It's a syringe with a little tube. We place it in the opening, and we inject the gel, and it blocks the lower and upper plugs. But in addition to stopping the drainage of your tears, as it breaks down, it actually goes back into the eye to provide passive moisturization. And studies are showing that patients that have severe dry eye and foreign body sensation, things like that, they're getting more relief and better results with the gel than they are with the plugs. Now, the only challenge to the gel, because insurance covers them both equally, is that we have to have a large enough opening that the cannula can fit in there to inject the gel. So we have to size up the patient. Most patients should be a candidate for this. And so we do this routinely at Wood Vision Source. And so a patient has a need for this. We'll talk about the difference between the collagen plugs, the silicone plugs, the cautery, and the gel. And then historically, it's been primarily collagen plugs. But our patients who are the Lacrofill gel, we're seeing this really great results with it. So both can be a fantastic way of doing things. But there's also ways that we can treat the eyes to produce better tears as well. So in our clinic, we're doing what's called low-level light therapy. We also go photobiomodulation. NASA created this back in the 60s to help our astronauts to retain muscle mass and things in space. This has been used for lots of things. With aesthetics, it's been used for making the skin healthier and for hair growth and things like that. With the eyes, it's a wonderful therapy to basically promote tightening of the lids and production of better tear quality. So in our clinic, we'll do a 15-minute red light photobiomodulation mask therapy. They sit there comfortably. They'll have a red light mask on. It's medical grade. It will stimulate the ATP from the mitochondrial cells, getting a little bit biology geeky here, but it stimulates energy in the cells. That's a fountain of youth treatment to get the collagen cells to make better collagen that tightens the lids and reduces the puffiness. It also stimulates the tear glands to make better liquid, the oil and the water. Our patients usually have a significant improvement in their skin tone, acne, rosacea, styes, droopy lids within 2 or 3 treatments, and their dry eye symptoms dramatically improve as well. And then in addition, we can do intense pulse light, or IPL. IPL has been done by dermatology for over 20 years for doing things like removing tattoos, removing hair, tightening the skin rejuvenation, wrinkles. In eye care, we use it for severe meibomian gland dysfunction to reduce the inflammation. It helps with dry eye improvements. It helps with making the skin tighter for droopy lids. So I found that if we do a combination procedure of the PBM low-level light therapy for 15 minutes, immediately followed by the intense pulse light, and then do an expression to kind of clear out those clogged glands, our patients have dramatic results and improvements. So it's been a very, very successful therapy in our clinic. And so we have a lot of patients who do that, and we're happy to help them with that. It's not an insurance covered procedure like a lot of aesthetics aren't, but it's very, very effective. Usually, depending upon the severity of the problem, we'll do 3 or 4 treatments over the course of about a month or so. And then usually a maintenance therapy every 3 to 6 months to kind of keep it in check. That's been a great way of managing it as well. So,
think about, and not to interrupt, but think about for patients who are concerned about the cost, think about how much you're spending in over-the-counter drops. How much you're spending on copays, going in and out for different procedures, or procedures aren't covered, or, all these different things. And think about the time lost in work that, there is a cost to that as well. So
there is.
Like that, it would make perfect sense. Really. It's not as expensive as you think.
Absolutely. And one thing that we do is that, some patients come to me and they've had an IPL procedure from their dermatologist for skin rejuvenation. They're using a different type of IPL. It's a very, very high energy. And you may have had ultrasound gel put on your skin because you need that to dissipate that heat, but it also can hurt. It's like a rubber band popping your face. And I've had some patients say, there's no way you're doing that to my eyes. Well, we're using a different type of IPL. It's basically has a cool fan product that we don't need a gel, and there's no pain. There's no slap to the eye. So our patients who've had the other, like, oh, this is much better. And so no discomfort whatsoever. It's a very quick treatment, in and out in 30 minutes, basically 15 minutes for the red light, about 5 minutes for the IPL. And then we do some serums and things on the eyes to kind of get it healthy for you. We want to make it affordable and, don't want to talk price too much, but a lot of doctors will charge, thousands of dollars for these treatments, and justifiably, because the equipment's very expensive. We want to make it ascertainable and affordable for the average patient. So we do packages. Typically we do a package of 4 treatments for $700. It's about half of what most patients charge. And currently at Wood Vision Source, we have a promotion right now. Basically, it's kind of a buy 3, get 1 free. So basically $500 for 4 treatments. That'll be through the end of summer. So if anyone is saying, I'd like to try IPL and a little light therapy, we're happy to help you with that. Call us a clinic. And again, we're knocking off $200 for that 4th treatment for the next couple of months.
Absolutely. Yeah. That is wonderful. Good for you. You're always so good about that and making things accessible. Thank you. Wonderful.
It can't work if you don't do it right. You have to make it where people can get it done. And we have payment plans and things like that as well to help out.
Yes. Yeah. Oh, that is wonderful, Chip. Thank you so much. Wow. What a wonderful amount of information. So I appreciate that. Well, tell us where we can find you and more information on all of this.
Yeah, so Dr. Bobby Chip Wood, but all my friends like yourself call me Chip, and Dr. Chip is just fine. Wood Vision Source in San Antonio, Texas. I forgot my phone number earlier, so phone number 210-682-4300. But in the modern age, our website, www.woodvisionsource.com. Check us out at Instagram at wood_VS. And we have a great group. I have 2 other doctors in my clinic. They are also highly trained for glaucoma, dry eye, high definition vision correction. They're all available to help our patients and see them. We have an amazing staff, and we provide full service. We are not a surgical clinic, and so we partner with the best surgeons in San Antonio for those who need refractive lens exchange and LASIK and those things, and do co-management. But other than that, we're treating both vision and medical eye care, and we've had a great relationship, you and myself, in managing our patients together who have conditions that need your expertise and my expertise. And and we are welcoming new patients as well. So we're glad to have anyone. And if you're not in the San Antonio area, again, I am a member of Vision Source, and I have many, many colleagues, 3,000 of them nationwide. If you're in a foreign state, please go to your local Vision Source clinic, and they can help you with these same procedures as well.
Absolutely. And thank you for that. I appreciate that. It's such an honor. We are going to have you again. There is more to you can see, folks, why I love him so much, because he's always got such great information. He's been my doctor for years and my family's doctor for years. Now my husband's doctor. So that's it. Hands down, you're the best. Thank you. So
well, you're amazing. Thank you for all you do for spreading the word about both medical and holistic self-care. You are making everyone healthier, and I applaud you for all the great work you're doing.
Thank you. I really appreciate that very much coming from you. So, well, we will have this air, and I'm going to have all this information at drpbetterlife.com, so you can find Dr. Wood and all this great information. And thank you. I appreciate it. We will have you on again. And folks, is there anything you want to say, kind of tying up, anything we left out or message?
There's a lot of great things out there. And if you have an issue, don't just accept it. Just don't sit back and let it happen. Seek out help, because whether it be dry eye, migraines, better vision, there's lots of great solutions out there. So if we can help you, let us know.
Well said, because I think many people do say, I'm getting old, or this is just the way it is, and just kind of live with it. And the eye is something you do not want to mess with. So lots of great things you can get done. Do reach out for help. Awesome. Chip. Thank you. Everybody, I hope you have enjoyed this, and have a great week, and we will see you next time.
You've been enjoying The Better Life with Dr. Marianne Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.